Throughout our scientific careers, we've both struggled with how we're going to cure tuberculosis in our lifetimes and also our children's lifetime. Tuberculosis is one of the leading killers worldwide. In 2011, 1.4 million lives were lost to tuberculosis infection. There were also 8.7 million new and recurrent infections.
In the face of this challenge, we are now seeing a great deal of drug-resistant tuberculosis cases. Some 3.7% of newly diagnosed tuberculosis patients and 20% of the patients previously treated against the disease are suffering multiple drug resistance. Even worse, 9% of these previously treated patients are facing resistance to all the antibiotics that we have.
I spent 10 years of my life working with patients that are infected with human immunodeficiency virus, HIV. And what happens with these patients is that their immune system declines and they become ultimately infected with Mycobacterium tuberculosis. And the majority of them die of tuberculosis disease. So this has been a motivating factor in my career.
I have worked in Colombia for 5 years with tuberculosis patients as a medical doctor, and I witnessed all these patients that started having drug resistance. So all these antibiotics that we had to treat tuberculosis are no longer curing their disease.
The only vaccine against Mycobacterium tuberculosis infection is called the Bacillus clementi-Guerin vaccine. But this vaccine only protects in infants and small children. We know that in different areas of the world, BCG does not protect against adults, and therefore we really need a new vaccine. We know now what we didn't know then when we were working with tuberculosis and HIV patients. We know now that all the work we've done has been using laboratory adopted strains. Now these strains don't infect the human patients. These are strains that we use in the laboratory, and many times we grow them up in large quantities and we pass them on in media many times. We know now that doing that to these bacterial strains reduces the bacterial strain's ability to infect the host. And so what the Innovative Award Grant has provided us with is the ability to look at clinical strains that actually infect human tuberculosis patients and look at how they modulate the immune system.
I came to Colorado State University because I believe that the research being done here is going to help cure a lot of patients and save a lot of people. Right now we have a new machine, a very powerful machine. It's called the FACS Area 3. With this machine, we are able to sort and find a specific type of cell that's going to protect the host against the infection.
Mycobacterium tuberculosis bacteria is transmitted through the air, and so we have to do all of our research in a high security lab that's called a Biosafety Level 3 laboratory. In this laboratory, we use animal modeling by using novel vaccines to vaccinate the animals. Then we take the cells out of these animals and we sort them using a FACS Area 3 cell sorter. After we obtain certain specific cellular phenotypes, we inject those into a recipient mouse to study how this mouse is able to kill Mycobacterium tuberculosis. I received funding to support these vital studies through a new Director's Innovative Award Program and stimulus funding. What we've learned through this grant is that Mycobacterium tuberculosis strains are not all the same, and that Mycobacterium tuberculosis strains that infect the patients modulate the immune system in different ways. And these strains have the goal of transmitting and infecting another human being.
Basically, this grant has allowed us to change the fundamental way we do tuberculosis research.
We would like to really recognize our research group that has spent many late nights in the Biosafety Level 3 finishing all of our research. We would also like to thank Colorado State University and the Mycobacterial Research Laboratories, and ultimately the Innovative Award Program for funding these studies.